If a patient doesn't have autonomy, I can share from at least from the pharmaceutical side, what ends up happening is if that prescription's written and the patient's not bought in, they just don't fill it, or they fill it once and they don't take it.
Right.
So that honest and open communication is broken, right? Because the provider assumes you're doing something and the patient doesn't want to and doesn't want to buy into that therapy. So the goal is lost, right?
Exactly.
And I've seen that over and over and over in time. And, sometimes, I will just politely say, probably after a few times, that I think you need to have a conversation, right? Like, I'm not forcing you to take your medications. I'm not telling you have to, but I think you have to have a conversation, because in a lot of ways, if you say you're going to accomplish a goal a certain way and you're not bought in, then it's a waste of time of you and your provider. And, this isn't going anywhere.
Exactly. Yeah, that is a really good point, Janet. Yeah, if that's not something that you want, make sure you speak up. If it's something that has a side effect and it doesn't work for you, make sure you speak up. Yeah, providers oftentimes have a kind of a set way of doing things because that's what they learned, that's what their experience is. So this is what I always do. And if that doesn't work for you, that's okay. It's okay to speak up. So I think we need to do a better job as patients with speaking up about what our needs are and how things are working, even if it might take a little extra time and effort.